Hello, I'm Dr. Susan Langer, a doctor of Oriental Medicine in Santa Barbara, California, with our dear friend Giovanni Maciocia. And we are back with our Sundays with Giovanni series. We are in Giovanni's library. And today I have a very special, precious question for Giovanni. And we both have a little treasure in our lives. Giovanni, you have little Rose, who is how old?
Nearly one.
Nearly one, your granddaughter. And I have a little Rosie, my great niece, who is 6 months old, and they both live in England. And so I thought it would be really good to discuss or explore Giovanni's series called The Little Treasures. And this is his Chinese herbal medicine series. He'll tell us a little bit more about it. But before we go there, I need to put in a very strong disclaimer, because everything we discuss in all our episodes is for educational purposes only. It is not to be construed as medical advice. So if you have a concern or an issue, then please always consult with your licensed or highly credentialed, qualified herbal medicine, Chinese medicine practitioner. And what we're talking about is information that is based on thousands of years of research and, as I say, educational and informational purposes only. So I've got that out of the way. Yeah. So the main reason I want to ask you about these little treasures, and here is a little example of one of Giovanni's little treasures called Little Sentinel for the immune system, is because they're talking of the immune system. There is a lot of concern right now with new families and young parents about the immune system, worries about vaccination. And Chinese medicine has been working with children and pediatrics for millennia. And whatever you choose to do with vaccination, the most important thing is to know how to work with childhood conditions and boost the natural immunity. And Chinese medicine is extraordinary for that. And most people don't seem to know that, which is why I'm so thrilled to be talking to you, Giovanni, today, because you've developed a series of 12 formulas, which are all in this little booklet, that we want to educate you so that you can find some really good practitioners and ask them good questions and maybe get some support from them. All right.
Yes, well, I should start by saying I introduced the 3 treasures probably 25 years ago now for the treatment of general adult conditions, and quickly followed by 2 years later by the women's treasure for gynecological problems. And then years later I thought that Chinese medicine is very strong on the treatment of children. Pediatrics has been a Chinese specialization for centuries.
Yeah.
Chinese have been treating children with Chinese medicine, with acupuncture, cupping, massage, diet, and herbs. Mm-hmm. So Chinese medicine has a lot to offer for the treatment of children, even modern children.
Especially modern children.
whose issues are very different than they were like 2,000 years ago in China, probably.
Yeah.
But by applying the principles of Chinese medicine has a lot to offer for the treatment of modern problems, such as hyperactive disorders, for example. Mm-hmm. Yeah. Or, as you say, strengthening the immune system. And in my lectures, I lecture a lot on pediatrics, and I always try to avoid the subject of immunizations because it's so controversial, and I never feel like telling a parent to do not vaccinate your child. I never do that.
Certainly not.
However, in my opinion, there is no doubt that vaccinations, immunizations potentially have side effects. There's no doubt about it. Yeah. Which is not an argument for not having it, necessarily. No. Just being aware of the potential side effects and doing things to prevent them or avoid them. For example, I use some herbal prescription to give a child after immunization.
Is that one of your little treasures?
No, it's not one of those. To prevent the development of what I call latent heat, which I think that's what vaccinations do.
Yes.
They create latent heat.
Yes.
Or I I advise parents, even if they do want to vaccinate their child, do it one at a time. Don't do those 3 or 4 together, which is much worse.
It is.
So you achieve exactly the same thing if you do it one at a time.
And you delay it.
You delay it, and it costs more because in England, for example, if you can have the vaccination one at a time, but you have to buy it.
You have
pay
to buy it.
and you pay for it. But
Okay.
it's absolutely worth it,
Worth everything.
for
Absolutely.
the health of your child.
Yes.
Other little tricks, like I used to tell parents to tell the nurse not to inject in a channel.
Oh, brilliant. Not to inject in a
They
meridian.
usually do it on the arm,
Yes.
and the large intestine is here, and the triple burner is there, and I used to draw the channels on the
Yes.
child for the nurse to vaccinate in between the channels.
Wow, I would never have thought of that.
Just very simple things like that,
Yes, that's a
which
good trick.
minimizes the potential side
Mhm.
effects. My son was not vaccinated. That's what I can say. That's all I can say. He's not,
Mhm.
and he was okay. He didn't
Yeah.
have any.
Yep,
Any
I know lots
problems.
of children that haven't, and their immune systems are thriving. But we won't go there. I know
No,
there's
we
a lot
want.
of
It's
research.
controversial,
Yes,
yes.
there's a lot of research if you want to follow up, but in this case, we're talking about options to support healthy immunity. And you talked about diet. Shall we start with diet first?
Very fundamental.
Yeah.
Absolutely so important.
Yeah, what can parents do immediately?
One of
to-
the basis of a child immunity is the diet from the moment they are weaned first
Yeah.
time.
Yeah, so breast milk first.
Of course,
Of
breast
course.
milk first. Of
And
course.
how long would you recommend?
Well, I mean, I would say personally, a minimum, I would say 3 months.
Yeah, I like to say a minimum of 6 to 9.
Yeah, it's better, 6 to 9 is better, but the minimum 3.
Yes,
Yeah.
great, great. And in terms of diet, and I don't know if you know, but I'm part of this amazing group of practitioners that work with pre and perinatal health and trauma. And so this is absolutely fantastic for me to hear you talk like this.
Yeah, of course, diet is absolutely fundamental for the child immunity.
Yes. And Chinese medicine has some really, really good.
And parents are
Thoughts?
many more parents are very much aware of that.
Yeah. So in terms of diet, more, would you recommend things more like, yams, sweet potatoes, to help tonify the spleen,
Yes,
help the digestion?
yes. And vegetables like carrots, for example,
Carrots.
yeah.
Hmm.
And yes, and of course, avoiding sugar.
And avoiding sugar, which absolutely knocks out the immune system
Yeah.
instantly.
Yeah.
It
Yeah.
slows down the macrophages and the white blood cells.
And apart from that, Chinese medicine has a lot of prescription to strengthen the immune system
And the digestion.
of children and their digestion.
Hmm.
And that's what the Little Sentinel is based on, the one you have.
This is the Little
It's
Sentinel.
to strengthen the immune system of children,
Hmm.
based primarily on the spleen and the lungs. Because one of the fundamental tenets of Chinese pediatrics is that all children we're all born with a spleen deficiency. The spleen is weak, not deficiency, but the spleen is weak,
Yeah, it's not mature yet.
not
is it?
mature yet.
Mhm.
It matures as you grow up. So any formula that is aimed at strengthening the immune system should start from the spleen.
So that would mean starting with, healthy breast milk. So
Yeah,
the-
which means that nutrition is absolutely fundamental.
Yes, and then the breast milk with the probiotics and the colostrum and all those
Yes.
wonderful things help nurture the little
Of
gut.
course. Yeah.
And then there are formulas. Which are your favorite pediatric formulas for maturing the digestion?
Oh, simple things like Liu Jin Zedong, for example, the Six Gentlemen decoction for the spleen. Very
Mhm.
simple things.
Is
That's the
that-
other great thing about children. They react so well to treatment.
They react well,
They
they
respond
react
so
fast.
well.
Yes, yes.
Also to acupuncture and massage. You can massage the points in
Yeah, you
very
can
small
massage.
babies.
Do you use the finger? Remember in the olden days we used to teach the finger?
Yes,
vein.
yeah, that's in all pediatrics Chinese books, but it's not something I've seen very frequently. You see that more in acute febrile diseases.
This is where we're looking at a vein that's along the pointer
Index
finger,
finger,
the
yeah.
index finger, that will, if there's a high fever, then it'll be quite red.
Yeah.
And how would you deal with, say, a febrile disease, like what, measles, chickenpox?
Chinese medicine works very well
It
for
does
those
work
febrile diseases.
Extremely well, yes.
Very well. I've treated a lot of those diseases, both in children and adults. And Chinese medicine has a fantastic theory of those diseases, which is the 4 levels, which is an absolutely brilliant theory of Chinese medicine.
It is brilliant. And I'm sure you're using those levels in your formulas, yeah?
Yes, yes, yeah.
So, okay, then talking of febrile diseases, which means, diseases that have high fever. In the West, I don't know what I think it's called paracetamol in England, but over here it's Tylenol, baby Tylenol.
Tylenol, yes.
Is it Tylenol in England?
No, here it's Tylenol.
What is it in England? Paracetamol?
I think it's yeah, it would be paracetamol, yes.
Paracetamol. So, what families are encouraged to do is anytime there's a fever or teething or something, to give the baby Tylenol. And that actually stops the fever, stops the heat. And we would consider, and you tell me if you differ from this, that actually reduces the immune system because it stops the immune system
Yes.
from burning off the bugs.
Yes, yes,
So we would say do not use Tylenol, yeah?
yes.
Because that just knocks things down. And there are actually some studies out now about Tylenol being used, and it's contraindicated during pregnancy, which is amazing, and after birth. So, there's a problem where some doctors are recommending Tylenol when you have vaccination, and yet there are also studies that are saying don't use it. So what we have instead, we're not saying stop using stuff cold turkey. What we're saying is there are actually amazing alternatives.
Chinese medicine has some great formula for what we call expelling wind heat, for treating fevers,
For treating fever.
which work really well, like the famous Yin Chao San, for example, which in my 3 treasures is called expel wind heat.
And what's your baby version called?
The baby version is also called expel wind heat.
Is it? So in your little treasures you
Yes.
have an expel wind heat.
Yes.
You give them some great names though. So is it literally called expel wind
There
heat?
is another one.
I don't know them off by heart.
Let's see.
So this expel wind heat is a really important concept in Chinese medicine. So when there's a fever, you don't want to sedate it with aspirin or baby aspirin or Tylenol. This is from our Chinese medicine perspective. You want to actually burn it off and flush it out.
Yes.
Yeah. And that helps the immune system. It also helps the child grow in terms of maturity.
Yeah. In the little treasures, there is one that corresponds to expel wind heat. There is throat soothe,
Throat soothe.
because of the sore throats.
Sore throats, and children get sore throats a lot, yeah?
Yeah.
And I think you have one with...
And they work very well, those Chinese formula for expelling wind heat.
And that could be earache.
And also Chinese formula for the later stages of a cold or flu. If it goes to the chest, they have a cough, then they're also a very good formula for that.
So could that include a condition that young parents have become very terrified about, but in our day it was considered nothing? Do you know what I'm talking about? Whooping cough.
Whooping cough.
Yeah, pertussis.
Yes, that can be
Yeah.
treated too with some of this formula, yes.
Yeah, it's like, people are being terrorized, unfortunately, but in the olden days, these were just all normal diseases that
They're
really-
terrorized even more with measles.
With measles.
Here in California, you remember there was this
The
so-called
measles
measles
outbreak.
epidemics outbreak, which
Yeah.
was, like 100 people or
I
something
think it was
like that?
300. Nobody
300.
died. Yeah, I know.
Yeah.
And a lot of them were
300
already
people in the
immunized.
population. What's the population of California? How many millions? I don't remember, but
I know, but I think that was used politically to push through the mandatory vaccination bill,
Yes.
unfortunately. But what we want you to know that there are some great, really, that there's great experience, amazing history. Is that right? And your formulas, how long have you had them for? About 7 years?
yes, about 7 years, yes.
Yeah.
Yeah, 7 or 8 years, yes.
And they are accessible.
See,
throughout
from the
world.
Chinese point of view, especially febrile diseases with a skin rash,
Skin rash like
such as
eczema,
measles,
measles.
German measles or
Chickenpox.
chickenpox, from the Chinese perspective, those are actually beneficial because the skin rash is a manifestation of a cell-mediated immune response. See, the skin rash shows that the body is reacting and it's killing the virus. And after you recover from that, the child is strengthened. The immune system is strengthened. And in ancient China, Chinese mothers knew that, so they were all, when the child got measles, they all had prayers. They started ambulating around the temple, round and round, saying these prayers that the child would go through the measles without the complications, because they always scare us with the complications.
Yeah, they do.
And so with the child going through that skin rash stage without the complication will be the best result, because with the rash it expels toxic heat from the, and the immune system is actually strengthened from having had measles.
So
Not long ago, it's not only in China, in England, not long ago, in the 1950s, there were measles parties.
there were measles parties and chickenpox parties.
When
and
the child got
mumps
measles,
parties.
they had a party so that the children would get it
Yes, exactly.
and get over it, you know.
Yes. And kids loved to be home for a week when they had their measles, even though it wasn't fun to have rashes.
No, of course, and I will still use some
herbs.
Chinese prescriptions for
Yes.
wind heat. You don't just
Exactly.
let it go, you don't just let it rage.
No, there are tools to help
Yeah.
kind of support it and
Yes.
contain it,
Contain it, yes.
Yes.
And prevent complications.
prevent complications. And so that's really important. I just want to refer back, the homeopaths, you know, homeopathy's been around for at least 200 years, of course,
Yes.
you know, which is another wonderful modality for children. But the homeopaths have always said that children grow, they mature and their immune system gets stronger and they come out older and wiser
Yes.
after childhood illnesses. I didn't know that the Chinese talked about that thousands
Yes.
of years ago.
Yes.
That's fantastic. Yeah.
Yeah, but as I said, pediatrics has been a specialty in Chinese medicine, specialization in Chinese medicine for centuries and centuries.
Yeah.
There are hundreds of books on pediatrics.
And you probably have a lot here.
And
too.
I have some here, yes.
Yes.
Yeah.
Terrific. Okay, so what else would you like people to know about? Your formulas, for example, or you know, how to work with children.
As I said, some of the formula there and the little treasures are based on ancient formula for colds and flus like that, or the second stage of a cold and flu, and there's a chest problem, a cough problem. And some are more modern. There is one, for example, for hyperactivity disorder.
Okay.
And there is one
Yeah,
little
which
sentinel you've
Little
got
sentinel.
to strengthen the immune system.
Yeah, and then you've got bedwetting. I'm going to read them
And
out.
there's one for bedwetting and one for sleep in babies.
Okay, so they're such great names. Okay, Breathe Easy for asthma.
Yes, for asthma and cough. Yeah.
Chest Release.
That's for the second stage of a cold or a flu when it goes to the chest.
Yeah.
With cough and phlegm.
So in Chinese medicine, we talk about the first stage, which you treat in a certain way to flush out the
Yes.
heat and the bugs, I'll call them. And then if it goes deeper, that second stage, it's a different set of formulas
Yes.
and herbs. So then we've got Clear Radiance. I love these names.
Clear radiance is for the skin.
This is skin diseases,
Skin diseases.
atopic eczema.
Yeah.
Okay. Dry Sleep. That's an important
For
one.
bedwetting.
For bedwetting.
Yeah.
So these are relevant for all ages, yeah?
Yes, all ages. I should never use herbal medicine in a baby under 6 months, though.
Okay, nothing under 6 months, but after that you can start
Yes.
and find a practitioner. You're not going to do this yourself, you're going to work with a practitioner. I'm just going through these so that you know the scope of what's possible with Chinese medicine, so you don't have to worry and always think that perhaps you should give your child an antibiotic. When, as we know, this is even in the media, that antibiotics aren't working that well these days. So what do we have left? We have homeopathy and Chinese medicine, yeah? And nutrition, of
Yes.
course, and good diet, healthy diet.
And very fundamental, the diet.
Fundamental, organic, whole food, not processed food, no GMOs, food that looks real. It is
Yes,
real, yeah.
yes.
Pesticide free. So what else? We have ear release, that's an important one.
Ear
And
infections in
yes.
children, very common.
do you think that dairy contributes to ear infection? I know this is
Yes,
controversial.
well, they contribute to many things,
Yeah,
including allergies,
Yeah.
especially atopic eczema.
yeah, okay.
By the way, talking about allergies and atopy, the development of the rash from measles helps prevent allergies, allergic diseases, and atopic eczema later in life, or allergic asthma.
So what you're saying then is if we don't have a real bout of measles when we're little, we could very well get allergies later on.
Yes, we do.
Yikes.
Allergic diseases are skyrocketing
They're skyrocketing, yes.
in the last 50, 40, 50 years.
Yeah, I know.
Not by chance, with
No.
the increase of the immunizations.
Exactly.
That's hygiene hypothesis. And children in Steiner schools have much less incidence of allergic disease because they don't have so many antibiotics or immunizations. They have
Exactly.
less immunizations and antibiotics than the general population.
So listen closely to what Giovanni's saying because he's got a lot of experience with this. You're absolutely right, and there are studies to show
I
this.
treat, especially in England, I treat a lot of children with eczema and asthma, and adults.
Mhm.
A lot, so many. The classic history, people with eczema and asthma since they were
Yeah,
babies, 7 months old.
and had usually been vaccinated.
And in the
Yeah.
30s, they still have eczema, and they still have asthma, and all they get is Ventolin and Becotide
Yeah,
and cortisone cream.
yeah, and then that suppresses everything. There's an important word called suppression in homeopathy, and the same in Chinese,
Mhm.
which just pushes down the infection and the toxic
Yes.
heat.
Yes.
So what we want to do is bring you a little ray of sunshine, that there are some other options possible. It's not either antibiotics, or nothing. It's actually you have some choices that really support the baby's or the child's immune system. I'm going to keep going here, yeah?
Yes.
But that's really, really helpful, Giovanni. So we've got Little Sentinel, which is the little sample I have, Little Sentinel for the immune system. Yeah?
Yes, to strengthen the immune system.
And that supports the lungs and the
Spleen,
spleen,
primarily, yeah.
specifically the immune system. Lucid Mind.
That's
a good
for
one.
the hyperactivity.
Yeah. So that, what does that calm down the heat and
Yes, on the one hand, it calms down, but it also opens the Shen orifices,
opens the Shen?
so they can concentrate more.
And the Shen orifices are?
The Shen orifices.
Because remember, these are people who don't know Chinese.
Yeah,
medicine.
the Shen orifices are, well, it's kind of impossible to describe what
I've
they
caught you
are.
out. I wouldn't know how to describe it.
Let's say the Shen can be obstructed, okay? So your thinking is not clear, or in severe cases, you have a mental illness. The mental illness shows that the Shen is obstructed.
Okay, so we were just talking about lucid mind and how sometimes, and that helps to clear the orifices of the Shen. And one of the things that blocks Shen is phlegm, yeah?
Yes, the main.
The main.
Yes, yeah. Which, when it blocks the Shen, it can cause either hyperactivity disorder
Mm-hmm.
or lack of concentration, lack of...
Mm-hmm. So when your orifices get blocked by toxins or phlegm, and phlegm
Yeah.
is one of the main things that's often created by toxicity, then it's hard to think straight and hard to act and hard
Yes.
to function.
Yes.
Yeah. And that takes us to the next formula, which is resolve phlegm.
Yes, that's also phlegm, but in a different context.
Mm-hmm.
It's more the phlegm that is in the chest, so more on a physical level.
So when a child gets like a chronic chest that's very loose,
I have
and
two remedies for phlegm in the chest. One is phlegm in the chest after a cold or a flu,
Mhm.
at the acute stage. So
and that would be
that would be chest release. Yeah.
Okay.
So the child has got a cold or flu or a sore throat. After 3 or 4 days, it goes to the chest. He has a cough at night, a lot of phlegm.
Mhm.
That's also phlegm in the chest, more in the acute stage.
Okay.
If that goes on, which it happens all the time in children, that
Yeah.
goes on, they may get another cold, another infection, and
Yeah.
maybe they have antibiotics, and that even suppresses the phlegm even more. So the phlegm becomes chronic,
Okay,
and the child has a cough for 6 months or 9 months,
yes,
and that's the remedy. Resolve phlegm.
resolve phlegm. So what we're exploring is different stages of childhood illness that Chinese medicine understands and can work with.
Yes.
Yeah.
Yes.
Yeah. So we're not telling you to go to a Chinese medicine practitioner and say, I want resolve phlegm or give me lucid mind. It's just giving you an idea of what's possible and then trusting that your practitioner knows what to do, and they'll probably make it very specific for your child. Yeah. Next one.
Next one. What's the next one?
This is so fun. Ooh, this is a great one.
What is it?
Silent night.
What's that?
Silent night.
Silent night. Oh, that's simply for promoting sleep in babies who are maybe teething or they've got some gas or heat. Babies are very prone to heat,
Yes. Yes.
and that's what the remedy is based on.
So,
Promoting sleep.
so if you have a baby that's up every hour,
Yes, that
Okay.
cries a lot at night, and not necessarily only a baby, also children,
Children.
who don't sleep well or have nightmares.
okay, that would be, so that helps calm that.
Yes.
Is it bringing the Shen, is it more for not sleep because of colic and digestive disturbance, or
Both.
is it all for calming the Shen?
Both.
The
both.
Shen is when the heart, the spirit of the heart goes
Both.
scattered.
Both
So
situations.
that calms everything down.
Calms the Shen, yeah.
So if a baby is agitated or the family is agitated or there's stress going on, then it will calm.
Yes.
In fact, the parents should probably take it too then.
Yes, yes, yeah. And in some countries, parents put a lot of stress on children, especially when they're older for their schooling, and a lot of stress at a very early age, very young age, far, far too early.
Japan is an example.
Japan and China is
China
even
too.
worse.
Oh really?
Yeah, in modern China, it's even worse.
So this is where they might need silent night to.
But in some families in England too, it happens.
More and more now. More and more. Ouch. Okay, so do we have here? We've got the next one is sinus relief.
Sinus relief, yeah,
Yes.
that's a very common. It treats this whole area in children. Very common focus of chronic
Chronic infection.
in the sinus, the adenoids, in the ears, and the tonsils.
Yeah, that
All
whole.
these, yeah.
So they're the really good herbs to just get that moving.
Which
like
in Western medicine they want to remove the tonsils, remove the adenoids, and often it doesn't work. It doesn't help. You know that the tonsils can grow back. It's amazing what nature does,
Yes.
what the body does.
Yes.
Our tonsils can actually grow back.
Yes. Yeah, and sometimes just removing the tonsils doesn't actually get rid of the infection. It seems
No.
it does, but it will go down deeper into the body, like
Yes.
the spleen. for
And that's
example.
very common in children, this problem. The adenoids, the sinus, and the tonsils, and the ears, all related.
And you've created a Chinese formula
Yeah.
to help with that.
Sinus relief.
Sinus relief. Yes.
No.
Okay. Then we've got throat soothe. We've got two more. Throat soothe for acute sore throat and tummy soothe.
Throat soothe is a variation of the famous Yin Chao San,
Yeah, famous formula.
which in the Three Treasures is called expel wind heat, and it's for the initial stages of an upper respiratory infection, basically.
And
With sore throat, that's what it's called throat soothe. And the last one is
Tummy
soothe, because which child does not have tummy problems at some time of their lives, either as
Yes.
babies or later on, is the most common pathology that children have,
yeah,
digestive problems, because the spleen is immature, it needs to mature.
so, and that would be maybe at children up to about 12. You would reckon
Yes,
these would be good for?
yes, older children have that too,
Yes.
a lot.
So these are really important formulas for a very, very common, wide range of childhood ailments. Yeah?
Very common, all of
Yeah.
them.
And if you want to get this little booklet and read, there's a lot of very, very detailed stuff which we don't really have time to go in today, but said you could go to your website.
You can go to the website, which is 3treasures.com, 3-treasures.com, and there's a list of distributors, and all distributors will have that.
We'll have this. And that's how you'll also probably be able to find practitioners, local practitioners.
Yes.
Yeah, that can support you and your family in a really healthy way. Now, Giovanni, I know, and I'm not going to discuss it now, but I know that you talk about the different stages in childhood. You talk about the 5 elements in childhood, which I'm fascinated about. You know, the different, the po, the hun, so maybe next time, to be continued.
Yes, Chinese books do that. Chinese pediatric books do that.
Yeah.
Do talk about the stages.
Yes.
There are different points of views from which it can be made, that classification.
That classification of the
And I have my
elements.
own according to the 5 spirits.
Yes, I know you do.
The Zhe, the Yi, the Hun, the Po, and the Shen.
Yes. So maybe to be continued?
Yeah, to be continued.
Always to be continued. There's always another pearl that you
There's
have
always,
to share.
yeah.
All right. Well, thank you so much. And I know there was a really important point you wanted to say about guilt.
Yes, I wanted to say to mothers, and it's very stressful, this situation with immunizations, should I vaccinate it or not. It's very stressful, very controversial, and also the use of antibiotics. And when I saw my patients, I always told them, don't stress too much. It's not the end of the world if a child has antibiotics once. So don't stress too much about it. And by the way, those Chinese herbs for resolving phlegm in the chest can be combined with antibiotics. It's not either or. Should I have antibiotics or should I have Chinese medicine? They can be combined. There is no problem at all.
That's a really good point. Yes.
So I'm very mindful of the stress mothers are under. So I always told them, don't stress too much. It's not the end of the world if you give them antibiotics and if you're worried.
Yes. Yes.
Yeah.
And there's nothing to beat the things you can do for yourself. Work on getting really good sleep with your baby. Excellent, the best quality food you possibly can. Things that are rare these days for children.
Yes.
Yeah, and a happy, healthy family, and lots of playtime, and lots of fun time with family. Would you agree?
Of course, absolutely.
Yeah. Wonderful. Well, thank you so
Thank
much
you.
yet again.
Thank you, Susan.
In honor of our little treasures.
Thank you.
Bye.
MeridianHolisticHealth.com